One of the troubles with smoking, whether it's a pipe or a cigar or a cigarette or marijuana or whatever else we're smoking, is that when you're burning it and you're puffing on it, there are a whole series of chemicals that are in the smoke called tar. And we all kind of know tar. You make asphalt roads out of it. They make the black stuff on the roof so it doesn't leak. It's kind of stinky. You don't want it on the shoes. You don't want to bring it on the carpet. It turns out when you're smoking or when somebody's smoking, the tar chemicals are all in the smoke, and they're around our nose, mouth, and lips. And what happens is those tar chemicals go directly into the bloodstream, okay? And so if you think about it for a second, think about an artery like a pipe or a tube or something like that. The blood's going back and forth in the body. All of a sudden you've got this tar that's in the bloodstream. And what they've noticed now is the tar makes a scratch on the inside of the blood vessel wall. What happens is, if I got a scratch on the outside of my body, like from a cat, or I hit a nail or a fence post, we know what happens. I get a scratch, it bleeds a little bit, the bleeding stops, then a scab forms, and underneath the scab, the skin is furiously trying to fix itself. You know, there's a repair mechanism that the good Lord put there, and so it's trying to fix itself. So after a couple of days, the scab falls off, I got new skin. Cool, I love it. So there was injury and repair, scratch and repair. Come on in. So back to the smoking. So we're smoking, the tar gets into the blood, and the tar scratches the inside of the blood vessel wall. Well, that's a tube, there's blood going back and forth there. It's got to be fixed, just like on the outside of the skin, but it's different. Inside the blood vessel, there's cholesterol that's floating in the blood, looking like melted butter. Not hurting anybody, just floating in the river, floating in the blood, not hurting a thing. Oh, there's a scratch from the smoking. Then the cholesterol goes in like putty or like cement, and it hardens. Scratch, in goes cholesterol to the wall of the artery, and it hardens. Scratch, in goes cholesterol to the wall of the artery, and it hardens. Well, pretty soon, it's not just flush with the inside of the tube anymore, but now you got this bit of cholesterol that's in the way of the blood, and it's actually kind of growing into the tube, so the blood has to kind of go around it, like I would have to go through a parking bump out in the parking lot and things like that. And pretty soon, you keep smoking, scratching, the thing is growing with more cement, more hardened, more cholesterol like a rock, and pretty soon you go from 4 lanes to 3 lanes to 2 lane to 1 lane, and you're shutting down flow. And if we shut down flow for 20 minutes, just like the rat under the water, what you got? You got dead tissue. In the case of the heart, you've got a heart attack. The brain, you've got a stroke. So a lot of people kind of know that smoking isn't real healthy, but I think a lot of people hadn't connected the dots. And so smoking produces the tar, which gets into the blood, which scratches the arteries. So that's a new thing that they have kind of been understanding a little bit that they didn't understand before. So a lot of people said, that isn't good, that isn't real healthy for me or my aunt or my uncle or my daughter or whoever's doing it. So a lot of people said, okay, if the tar is the real bad guy, how do I get around that? Well, one of the ways that people have gotten around that is they can just quit. Well, that sounds easy unless you've been smoking for a while, okay? So what a lot of people have done is they've used nicotine things. So they have nicotine patches you can put on your skin. They have these electric cigarettes that you have puffers. They have nicotine in them, but no tar. So a person could put a nicotine patch on their skin, give them a little nicotine, and then they could puff on an electric cigarette, and they could do both. They get a little nicotine this way, a little nicotine this way. This is like a foundation, this is like a booster, and they're getting no tar. They're not scratching their arteries. So that could be a very safe way for somebody to get off smoking. Isn't that fascinating?